Hi, my name is Theresa Granowicz. I'm a master's candidate in the University of Arizona nursing program for clinical systems leadership, and this is my DOCC project assessment for nursing 660B. I will be assessing an 82-year-old male patient who's a known diabetic. You'll see as I walk in the room, I'll be using hand sanitizer to clean my hands, and while I'm greeting him, I will be assessing him for general items, things like his pallor, his respirations, if he's under any anxiety, apparent anxiety, if he has any appliances like glasses, hearing aids, canes, an insulin pump, anything like that. I'll be looking at his level of alertness and orientation and checking on those things. And I'll just be viewing his overall wellness status, his pallor, his comfort. We'll get started in a moment, and welcome to my video. Hi.
Hi.
I am Theresa, and I am going to be your nurse today. I know that you see one of the nurses in the practice in between visits with your doctor. Can you tell me who you are?
Yes, I'm Vince Granowicz,
Okay. And what's your birthday, Vince?
August 1934.
Okay. Do you know what year it is?
Do I know what year it is? Yeah,
Can you tell me?
2016.
Okay. Excellent. So, how have you been?
How have I been?
Yep.
Oh, other aches and pains, why not bad?
Do you have any pain right now? Are you in any distress at all, or just?
No, only with movement and stuff I get some pains. Pains after working around the house.
And right now, how would you rate your pain on a scale from 0 to 10, 10 being the worst?
0.
Okay. All right, good. Have you had any changes in your weight in the last 6 months?
Yeah, I'm up a few pounds since the doctor changed my medicine.
Okay. Tell me about your parents. Did either one of them have diabetes?
My mother had diabetes, but it was senior onset. She was in her about 80 when it came on, and it was very mild.
Okay. And how about your dad? What did he die from?
My dad died from a heart attack at 55.
Okay. And your mom?
She died from numerous things due to her age. She was 87.
Okay. Is there a history of stroke with your parents at all?
No.
Okay. And any other health issues that you're aware of that they may have had?
Well, my mother was overweight. My father had some things along the way. I mean, he had ulcers and hernia and a few things like that.
Okay.
But no, I'm not otherwise.
All right.
Oh,
Tell me.
I'm sorry, my mother did have breast cancer, and that was already in her late 70s.
Okay. All right. Anything else that I should know about your family?
Well, my brother has renal, actually not renal, he has leiomyosarcoma in the renal area.
Okay. Excellent. Not excellent. How's he doing?
He just had some recent surgery, so we don't know yet.
Okay. Tell me, I'm going to switch gears from your family to some of the way that you live your life. So tell me how much water you drink every day.
Oh, I drink a lot of water. I drink 1 to 2 glasses in the morning. I drink probably a bottle full here all day at work. I drink at least a big glass with dinner, and frequently 2, and then after dinner I sit around with a full glass of water.
Good. Excellent. So how long have you been a diabetic?
Oh, I can't remember. It's 12 or 15 years.
Okay. You gave the list of your medications to the MA today. How often do you miss a dose of any of your medications?
Right now, I've been missing a dose every week for the last 4 weeks because I haven't been able to get it. That's on one medication. Other than that, I rarely miss any medicines.
Okay. And how about insulin? You're taking insulin, is it daily? Is it multiple times a day?
I take several different types. I take what's called Toujeo, which is a steady state insulin, every day. Actually, he split the shot up. The doctor has split the shot up. I take a small amount in the morning and the rest at night before I go to bed. I also take a rapid-acting insulin, Humalog, just before dinner, and I take this Trulicity, which I'm supposed to take in once a week,
Okay.
that I haven't been able to get. So that's it. And
Okay.
insulin.
All right. How often do you check your blood sugars?
2 to 3 times a day, depending on when I've eaten. I check it every morning and I check it every evening, just before I take my Toujeo. And sometimes I check it before dinner.
Okay. And how have they been running?
Too high.
What's too high? What's the low of the highest that you've seen?
Well, since I haven't had the Trulicity, the low has probably been 123.
And what's the high been? The highest of the highs?
329.
Yikes. Is that in the morning or in the evening or?
That's evening.
Okay. All right. Okay. So I see also that the MA took your blood pressure both lying down and standing up. That was to see if you experienced low blood pressure with that transition. And your numbers look really good. So we're not concerned about your blood pressure today, which is excellent.
No.
Okay. Now, if it's okay with you, I'd like to examine you. Is that all right?
Yes.
Okay. I'm going to start with your head, and I'm going to work my way down to your toes. Okay, I'm going to ask you at one point to take off your socks and shoes so that I can look at your feet as well.
Okay.
All right? And would you take your glasses off for me, please?
Mm-hmm.
Okay. So I'm inspecting behind the patient's ears because he does wear glasses and he's diabetic to make sure there's no ulcerations. There's no lumps or noticeable changes in his skin of his head. I'm feeling now for lymph nodes. I don't feel anything swollen or outstanding. I'm going to check your vision just to make sure that your eyes respond equally to light. Okay. Okay, can you stick your tongue out at me?
Gladly.
Open wide. All right, excellent. You don't have any cracked or chipped teeth. When was the last time you went to the dentist?
Probably November.
And how about the eye doctor?
I'm due in November.
Okay, good. I'm just going to take just a peek in your ear just to see if there's anything grossly out of place. Okay. And When I checked for your eyes, I'm looking at your cranial nerves for the motor components, and it's cranial nerves 3, 4, and 6. So have you had any double vision or any problems with your vision?
No, the correction takes care of everything.
Okay. All right, I'm going to just listen to your pulses here. And I hear no bruise. I'm also going to listen to your heart. Okay, and I'm going to listen to your lungs. Take a deep breath in and out, in and out, in and out, in and out. Okay, and I'm going to listen to your lungs from behind as well. Okay, deep breath in and out, in and out. Okay, your lungs sound clear. I'm going to have you grab my fingers and squeeze as hard as you can. All right, very good. And I'm also going to check your pulses here. Okay, and your pulses here. Okay, and then how about your skin? Have you noticed anything? Do you examine your skin when you're in the shower?
It's dry, and
Do you have any discoloration in your armpits, or?
And it's thinning out. There's less fat under the skin.
Let me just check the. Yeah. Okay. Yeah, you're dry.
Papery.
Yeah. Okay. All right. So I'm going to ask you to go ahead and lay down. I'm going to evaluate this patient's abdomen. I'm not going to have him disrobe as I would with a patient, with an actual patient, because he's a volunteer. Is that comfortable for you, or do you want another pillow?
It's comfortable. I'll get by.
Okay. So I'm going to ordinarily look at the abdomen for signs of bruising from his injection sites and any abnormalities in the skin. I'm also now going to listen to his abdomen. That's good.
Oh, you wanted to look at the spots?
Okay. Okay. And I see you just have one tiny bruise here from your injection. There's no hardness underneath that bruise or anything to be concerned about.
I use my thighs too.
Okay. And how are your bowel movements? Do you have a bowel movement every day?
Just about.
Okay. Any problems with them? Are they loose or formed?
Oh, they're formed.
Okay. All right, excellent.
A little bit of constipation because I take cholesterol medications.
Okay. Now, if this wasn't my father, I would feel for his femoral arteries, but I will guard his privacy. And then how about your urinary habits? Do you go a lot at night?
None.
Okay. And do you have any pain or any color to your urine other than yellow?
No, very normal.
Okay. Now I'm going to go down to your legs, and the first thing I'm going to do is inspect your legs, and I see that you have not a whole lot of hair down here. I also can feel that your legs are warm, your feet are warm, your toes are a little bit colder. Okay. They're not discolored, they're not erythemic, there's no cellulitis noted. I'm also going to check for your popliteal pulses and your posterior tibialis and dorsalis pedis pulses. Okay, dorsalis pedis. Okay, you have good pulses. I'm also going to check for in between the toes for any ulcerations, because as a diabetic we could have injuries that we maybe can't feel because of neuropathy. I see no changes in your heels or in the bottom of your feet. There are no ulcerations, no boo-boos, so to speak. Capillary refill is good. It's about 3 seconds. All right, I'm going to check the patient for sensation in his legs. So I have a cotton ball, and this is what it feels like. And I'm going to see if you can feel it on your legs, okay? So can you feel it here?
Yes.
And here?
Yes.
Here? Do you feel that?
Yep.
Just say yes every time you feel it for me.
Yes.
Yes? No? Yes? Okay. Okay. Now I'm going to do the same thing, only with something that's slightly sharp. It's not really sharp, and it feels just like this. Okay? All right, can you feel that?
Yes.
And that? Losing it.
Yes. 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 Yep. Oh, yes. Yes. Yes.
Okay. Excellent. Now I'm going to check for proprioception, and I'm going to ask you to not look down this way. I'm going to isolate your toe here, and I'm going to wiggle it. Can you feel that?
Yes.
And I'm going to ask you to tell me if I'm stopping in an up or down perspective, okay?
Up. Down. Up.
Okay, and I'm going to do the same thing on this side.
Up.
And where's that?
Down.
And that? Excellent. Okay. Now, the last thing that I'd like to do is check your reflexes. I'm going to just ask you to just hold your knee like this. Okay. Oops, I missed it. we go. Excellent. And I'm going to check to make sure that you don't have a thrombosis here. So tell me if you feel any pain in the back of your calf. Okay. And on this side, pain? Okay. Excellent. Okay, and then just push for me like you're pushing on a car pedal. Okay, and then pull for me. Excellent. Okay, you can go ahead and sit up.
Come on. Turn on my side
Okay.
first.
There you go.
Okay.
All right. So, would you, now can you, are we still rolling? Okay. Would you stand if you, and make sure you have your sea legs, don't be
Yeah.
dizzy, and just walk to that side of the room and back. Okay, and return. Okay, and you can go ahead and have a seat. I'm just going to check the bottoms of your shoes to see how your wear is. It looks like you have fairly even wear in your shoes. Very good. And then I just want to talk to you about a couple of different things. Tell me, you told me that you drink quite a bit of water. Do you ever find yourself being really thirsty?
Only if I'm working outside or something.
Okay, and are you experiencing any numbness or tingling in your fingers or your toes?
Yes.
Okay, tell me about it.
Well, my right hand has had numbness in it since I was 25 years old. My left has recently joined it.
Okay,
Comes from some neck trauma. And I think I'm getting some numbness in the fingertips from punching myself several times a day.
okay,
My toes do have some degree of numbness. Just most of the time, that's all. It's never spread, it just stays right in the toes.
okay. And I'll make sure to make a note of it for the doctor to be aware of. Tell me how your diet is. Do you eat a lot of bread or eat a lot of sweets in your diet?
Probably both. Bread isn't as heavy as it used to be, but I still eat a lot of bread
Okay.
and tend to have a sweet tooth.
Now we gave you a diet plan to follow before. Are you following it, or are you mostly
Roughly.
struggling with it? Okay.
It's a struggle,
All right. What do you think is getting in the way of you being successful with sticking to that plan?
just that I have an extreme sweet tooth.
Okay. How many servings of alcohol do you have in a week?
In a week. 2, occasionally 3.
Okay. And then I know that you're getting regular checkups, which is very good. That's what we like to see, and I like that you're coming in to see us in between visits with the doctor. And you've seen your eye doctor and your dentist. Are you getting any exercise?
Only what I get around work or around the yard.
Okay. So we'd like to see you, and I know that I've told you this when I've seen you before, we'd like to see you getting 20 to 30 minutes of light walking every day, just for the purpose of exercise, not just what you're doing at work. You can build up to that, but it's important to maintain your health to get that walking in.
Well, as I told the doctor, that's never going to happen.
Okay, well, what will happen? Is there anything we can do to support you in your efforts? Would you like us to put you in touch with?
I tried exercising at one point and accomplished nothing. So.
Okay. Now you're married, right?
Yes.
And you attend church every
Yes.
week. And tell me just briefly about your social support system. Do you have, is your wife is independent in her activities of daily life?
Yes, she is, and she supports my activities and takes care of the house and various things. We have a very active life socially. We're out a lot.
Okay.
We have the children and grandchildren that we have to deal with and all doing things there.
Okay.
We have a lot of friends, neighbors.
Okay. Well, that concludes our assessment today. Do you have any questions?
No, I don't believe so.
Okay. So we'll see you again in a month, and the next visit the doctor will see you. And if you have any questions in the meantime, don't hesitate to contact us, and we'll be happy to help you out. Okay?
Okay.
All right. Thank you.